I'm Dr. Adam Rubinstein. I'm a board-certified plastic surgeon who practices in Miami, Florida, and this is my latest segment in my Exposed series, where we talk about doctors that maybe aren't telling the whole truth about their background and possibly misleading patients. We just finished filming my segment for Instagram, which is a real short version of what we're going to do here on YouTube, and you can follow all those segments on Instagram and others that are pretty cool in @PlasticSurgeryTruths. You see all kinds of videos answering questions, doing consultations, looking at results for patients, and of course, showing these exposed segments. Now, this segment is about Dr. Ayman Shahine. Dr. Shahine is a doctor who practices in New York City. He has an office in Manhattan, and he sees patients, I believe, in Manhattan and in Brooklyn. And he's known for doing liposuction and fat transfers to the butt, BBLs, as well as some breast surgery and maybe a smattering of other things. The thing is, Dr. Shahine is not a plastic surgeon. He's definitely not a board-certified plastic surgeon, and he's not trained in any kind of plastic surgery as far as I can tell from any records in the state of New York. What he is trained in is gynecology. He is a board-certified obstetrician and gynecologist, and I guess he believes that after practicing gynecology for many years, he's so familiar with the female body that, well, I guess he's good enough to be a plastic surgeon now. If that were true, then all these gynecologists should be running out and starting plastic surgery practices. No, don't, actually, because that doesn't really qualify you to be a plastic surgeon. Dr. Shahine believes that all those years of practicing gynecology qualify him to be a plastic surgeon, because on his website it says this background gave him special skills to understand the nature of the female body. So I guess if you understand the female body well enough, that's all you need to know to be a plastic surgeon. But it's not, and everyone knows it's not. The thing is, what everyone doesn't know is that he's only a gynecologist and obstetrician, and he's not a plastic surgeon. He may be qualified to deliver your baby or to do your pap smear, but he's probably not qualified or properly trained to be a plastic surgeon, and he's certainly not a board-certified plastic surgeon. Dr. Shahine became well known because he had a couple of testimonials that were recorded by some reality TV stars. And he had done surgery on those TV stars and got them to give him testimonials. Now, whether or not they were compensated for their testimonial with free surgery, or if they were compensated by payment for their testimonial is unclear. There's no statement one way or another on these testimonials on the website. He does have pictures that he shows of wonderful before and afters, but if you do a little bit of research, not even a lot, just a little bit, you're going to find that there's a number of patients that really are not happy. Now, just in a little bit of research, I pulled up a few different reviews from Yelp and from RealSelf, which are pretty good places to find people who are telling you what their experience was with a doctor. Now, I'm taking a look at some of these reviews, and these are real reviews. I'm just reading what I found online. This is from Sonia D, and it says, this is a patient who actually had surgery with him. I reported Dr. Shahine to the New York Medical Board, the Better Business Bureau, and to several news sources, including papers and television. I've never dealt with a professional, especially a doctor, who was this unprofessional and unethical. And she goes on. I waited in the room from 8 p.m. to 5 a.m. There was no one around, and they just leave you waiting with no clue of what's going on. Now, I'm only reading you segments of these reviews, but this is something you're going to see time and time again. There is a reputation for making patients wait hours, sometimes days on end for their surgery, no matter when they were booked, no matter when they were told to show up. In some cases, patients receive medications and then said, you know what, I can't do your surgery. We're going to get to that. So let's take a look. So at 5 a.m., I was woken up in the waiting room to meet the doctor for the first time. He was very abrasive, rigid, and unfriendly. The doctor gave me 3 unidentified pills, and told me to empty my bladder in the bathroom. When I returned from the bathroom, he told me he was too tired to perform my surgery and asked me to come back on Monday morning. So here's a patient shows up when she's supposed to, waits many hours, through the night, in fact, then first thing in the morning is given some pills, probably one of them was a sedative, goes and takes them, pees, comes back, and the doctor decides, you know what, I'm not feeling it. I'm not going to do your surgery today. Really? And it goes on. The patient ultimately just kind of gave up and said, okay, I guess I have to go home. So the patient said, I called my transportation from New Jersey to come get me, and started crying on the phone out of the traumatic emotions. Understandable. The doctor then told me this exactly, and she puts it in quotes. "Stop crying. I don't like that emotional stuff." "Fine, I'll do your surgery now quickly, but it won't be quality." What? This is someone who's supposed to be a professional, who's supposed to be a surgeon that's taking care of patients? What? All right, well, in fact, the next thing she says after this quote is, "WTF?" All right, so continuing, she says, 15 minutes later, as I'm waiting in the waiting room, the medical assistant told me that I had to go because she had to go pick up her kids. The patient decided, well, I'm definitely not having surgery. Smart, she didn't have the surgery that day. And now the coordinator comes back and says, "Listen, you got to go, I got to get my kids." She told me that 2 blocks away, the doctor told her I should go wait at McDonald's or Dunkin' Donuts. They kicked me out of their building at 5:30 a.m. in 30-degree weather in the middle of Manhattan with $6,000 cash on me. Okay, this is just one review, one person's story. Let's continue. This is from Lisa, also giving an online review. And she says, "I was scheduled for 8 p.m. surgery and was seen at 1 a.m. It's kind of a continuing theme. So after waiting all those hours, Lisa writes, during the procedure, you'll be poked with what felt like over 200 needles to numb your skin. I'm still scared from the lipo where my skin was literally ripped. Yes, you're awake. And yes, you will feel pain." These are her words. "After the procedure was done, I was not informed of any post-op. She wasn't given any instructions or what to do. Now, in other reports, this doctor has actually claimed that, oh, well, this patient had a bad experience, a bad outcome, because they just didn't do what I told them to do." But this patient is saying she wasn't told what to do. So let's continue. Shahine walked out in a bad mood and said nothing to me about follow-up or how I felt. I ended up with an infection in my buttock, which I thought the pain I felt was normal, and I was healing until the area became so warm and painful and ended up with a high fever. I mean, she had no follow-up. How was she supposed to know? "I never felt like he cared or ever saw him for follow-up because he's too busy for you or not there. My stitches, needless to say, my stitches by my butt, I was told, would come out on their own and never did. My boyfriend had to cut them out for me because my skin started healing over them. See, if you leave stitches in long enough, your skin continues to heal, and it's actually possible to bury stitches. Some people that heal quickly, well, sometimes we can have that happening a little bit, even in normal intervals. But when you're there waiting for something to absorb and fall out by themselves, and they don't, it doesn't take that long for you to have skin growing over it. So this poor patient did experience that. Let's go to another review. This is another review from AC. And I'm just doing this because I want to give you guys the research. I've already done it. You don't have to go do it yourself. If you don't believe me, please go ahead and check it out. Do your research, but I'm trying to make it easy for you. So here's a few more. AC. My friend and I had been seen by Ayman for a fat transfer procedure, and let me tell you, it was horrible. She went first. While waiting in the waiting room, I could hear her crying literally the whole time. When it was my turn, it was not different. I was in so much pain from the numbing process to the actual sucking of the fat that I insisted he stop the lipo process and just finish the transfer to my bottom. Not a great experience. Here's another one. This is ML. And again, this is a patient that was told multiple times to come back and wait. Here's part of this review. Upon leaving, I encountered a woman outside. She had done her procedure with Dr. Shahine, but had returned because she had fluid pockets in her stomach. She proceeded to tell me how excruciatingly painful her procedure was and that it was nothing like the videos he posts on YouTube. She also made another good point. If you notice his before and after pics, the afters are always taken on the surgical bed right after surgery. Because of the swelling, of course, your stomach to ass ratio is going to look great. Well, that's a good point, and I talk about that all the time in Plastic Surgery Truths. You really want to have longer term post-op pictures, and you want to be standing up because little rolls of skin, bulges, everything looks better when you lay down. If you don't believe me, go ahead and, if you have any extra rolls or skin that you don't like, take a picture standing up, then go lay down and have someone take a picture with the camera over you. You'll see that they smooth out a lot. It really looks better when you're laying down, especially on an operating table. When we take out a whole bunch of fat, it decompresses those folds, makes them thinner, and they do just kind of slide up and drape nicely. They can look perfectly smooth. But when you stand up, you're still going to have those folds. And that's important to know before you're going into surgery. It's also important to know when you're looking at before and after pictures that they're probably not genuine if you're seeing one standing up and one laying down. But wait, there's more. Here's another patient, Noreen, and she was talking about her experience with other patients. So one woman tells me she was scheduled for surgery on Tuesday, and they didn't call her until Friday. That's 3 days entirely sitting in the office, plus some time. That's unbelievable. So this patient was booked on May 27th, apparently. May 27th comes, so I call to inquire. I was told, oh, he will call you when he's ready. May 28th, no call. I call, and they say, oh, he's a little behind, he'll call. May 29th, no call. I call, and they say, what is your name? I tell them, and they say, I will give him your name. No call. It's now May 31st. No one has called. This patient was booked on the 27th. It blows my mind, just as a plastic surgeon, a real plastic surgeon, who is practicing and taking care of people, who cares about taking care of people, how can anybody wait that way, sit in a waiting room? And it's not like he's giving the surgery away. You know, he's not doing this for cheap. He's getting paid in cash. And that's, you know, from what we've seen in news reports, he takes payment in cash only. So I don't understand how someone can come with $5,000, $10,000, $15,000 in cash and pay that cash after seeing and hearing all this stuff. But there's more. Here is, well, we've got a couple more we can talk about. Here is Katrina. Says, I only gave 1 star because that's the requirement to write a review. She'd like to have given 0, but she couldn't. Dr. Shahine is extremely uncooperative, impolite, inhospitable, and downright rude. His office staff is inadequate, from the do not flush sign in the bathroom, do not flush in the bathroom, to the ceramic glass they give any and everyone wishing to have a drink of water. Okay, let's see. She goes on, Dr. Shahine does follow-up appointments while in surgery in the wee hours of the night. So you'll wait anywhere between 4 and 6 hours to be seen. I just don't understand. Why do people put themselves through this? But they do. Here's another one. This is C-Tebber 1. That's the patient's handle online. And this one says, I was supposed to have my surgery on the 26th around 7 p.m. I wasn't told to come in until the 27th at 5:30 a.m. I didn't see the doctor until about 8 a.m. He explained to me what he was going to do. When he told me I would be awake, I freaked. Yet another person that didn't know that she would be awake. It was horrible. First, the anesthesia was given with a needle to all the areas he was going to work in. This process sucked. He assured me that this was the worst part, and I would be numb and only feel pressure after that. He was wrong. I have a high tolerance for pain, and I cried through the whole procedure. She added a little bit, it's a very long review, but she added an update. So it's been 1.5 years since my surgery. What a waste of $7,000. My stomach is so uneven, and I wear shapewear every day, all day. My butt is no bigger than what I had before surgery, and the scars are terrible. I followed the directions and actually never even got to see the doctor for any post-op visit because it was always some ridiculous time, like 12 or 2 a.m., that he would be available. All right, so we see some of the problems here. Now you would ask yourself, a guy like this, doesn't he get in trouble? How does he continue to practice this way? Well, he does get in trouble. I'm not sure how he continues to practice, but he does get in trouble. According to the records in the state of New York, he had 8 different settlement payments in varying amounts, and he had 1 judgment against him over the years. According to a news story recently, there are as many as 10 lawsuits still pending against him. Besides that, there is an ongoing investigation in the state of New York. The state of New York has an investigation in which there are 29 counts against him that are alleged. This investigation is ongoing, so these counts have not been proven or disproven, but the state did an investigation and charged him with 29 counts of misdoings. Among those counts, there are let's see, there are 8 counts of failure to maintain records. Failure to maintain records is basically doing something and not actually writing it down, so there's really no way to tell what you did and what you didn't do. It's possibly a way to do something you probably shouldn't do and just not keep a record of it, but maybe it's just a negligence in not writing down a record. Maybe you do everything right, you just don't write it down. It's just not cool. You have to keep a record when you're taking care of people. So that's 8 counts of that. We've got 5 counts of gross negligence. I think you guys can figure out what that means. And then there's a count of negligence on more than one occasion. That's probably with the same patient being negligent in more than one time. Then there's 3 counts of unwarranted tests and treatments. That's ordering tests or doing treatments to someone that were not necessary. 3 counts of that. 5 counts of fraudulent practice. There's 5 counts of false reports, and that's actually writing down what you did, just lying about it. 5 counts of that. And then to be the icing on the cake, there's a count of gross incompetence and incompetence on more than one occasion. So there are 29 counts in all that are being alleged against Dr. Shahine, and that is under investigation. I'll be very interested to see what that investigation finds when they come out with their findings. So all of this controversy, and you wonder, how does anyone not know about it? Well, people do know about it. That's the crazy thing. People do know. A few years ago, there was a story done on WPIX. He was the subject of their investigation, and they showed some crazy things about it. And you can check it out. We'll put a link to it in the caption under the video, so you guys can check that out. WPIX did a whole story. Got some attention, but didn't seem to change things as he kept working. Most recently, I was able to collaborate with Inside Edition, and we did an investigation where I went undercover with their investigative reporter, Lisa Guerrero, and we went to go get a consultation in his office. Well, let me tell you about that. We went with hidden cameras, and we made an appointment, showed up as a couple, and Lisa was getting a consultation for surgery. She was going to ask about having a little bit of lipo. The first thing is you walk into the office and it's very cluttered. It has the wall space entirely covered. I mean, like postage stamps everywhere of posters of before and after pictures and testimonials and just all kinds of things. I mean, it was unbelievably cluttered. I'm not kidding. Not any wall space did I see that didn't have some kind of poster or before and after picture or some comments from a patient, and just plastered everywhere. Definitely not my style. Personally, in my opinion, I find that super tacky. But in any event, that's the way the office is done, and it's kind of small, so it feels tight. Now, ultimately, we get called in for the consultation. First, Lisa goes in, and she's seen not by Dr. Shahine, who wasn't even in the office at the time and was not available. She was seen by his consultant, which is unfortunately the way some people do their practices. They have a consultant that sees the patients and not the doctor, but it's really, really not the best way to go. A doctor should be seeing you before you sign on for any surgery. The doctor is the most qualified to give you the opinion as to what the best procedure is, what will help you, what won't help you, and help you make good choices. Consultants might know a lot, but they're not doctors, and they're not the one that's going to be doing the surgery. So regardless, that's who we got to see, was the consultant. Now, the consultant gave some, got some information. She gave a little bit of an opinion as to what might be a good idea, and then I left the room and Lisa was examined, and after the examination I was invited back in. Now, we went in for a little bit of liposuction, and we were talking about just kind of love handles. Now, Lisa Guerrero is a beautiful woman. She is very fit. If she came to my office and asked me to do liposuction, I'd probably tell her no and just say, look, you look too good. See me in a few years if something changes, but you don't need surgery. But instead, she was told, well, you could use some lipo here and there, and she pointed out 2 or 3 different areas. And while we're at it, why don't we put it in your butt? She didn't come in there for that, but hey, why not just throw some fat in the butt? And by the way, how about some breast surgery? I'm not joking. She was advised to have breast surgery, lipo in multiple areas, and fat transfer to the butt, and went in only asking for a little bit in the love handle area. All right, so that was the advice of the consultant, who, by the way, we asked, are you a doctor? Oh, no. Are you a nurse? Yes, I'm a nurse. Well, that was not true. She was not a nurse. And in fact, later on, when Dr. Shahine was interviewed and asked, is this person a nurse? He said, no, she's just a consultant. And he was told, well, she said she's a nurse. His response?
No, she didn't. She does not. You're lying.
I'm not kidding. He told Lisa Guerrero, you're lying. You can see it. We'll have the link. You just check out the link below. You'll see he tells the investigative reporter of Inside Edition that she's lying. And that was after agreeing to have an interview when first he tried to push the camera away when they found him at the office and refused to speak to them. And he did come back and have an interview, and you can see the whole thing in the link below. My opinion of what I saw when we went for that consultation was it was extremely unprofessional. I believe it was unethical. We could have booked surgery. She could have been in there within a day or two having surgery, having never seen the doctor. And you've seen that in some of these reviews that we've read. The people meeting their doctor for the first time the day of surgery. The American Board of Plastic Surgery, the American Society for Aesthetic Plastic Surgery, these organizations believe that that would be unethical. That simply is not proper for a doctor to not see a patient, not give the proper advice, do a full exam, and make sure that we're keeping someone safe. But that seems to be the way that Dr. Shahine operates. Literally operates. That was my experience with Dr. Shahine. So I expect if you're considering using him as your doctor, you may find that your experience is pretty similar. Just based on these reviews and the things that I've seen, I don't think you should expect any different. I did get to interview a couple of his patients. I spoke to the 2 patients that were featured in the Inside Edition piece that you guys can see. I met with them personally. I got to examine them, and it's a mess. One of them has already had corrective surgery, and it's still a mess. So be careful. Make sure you do your homework. As always with these exposed segments, my goal is simply to give you the truth. And everything that I'm telling you is all public information you could have found for yourself. It's in public records. You just got to know where to look. I know where to look, but not everyone does. And it's hard to get the information if you don't know where to find it. These exposed segments are meant to help you get the truthful information, often about doctors who maybe aren't so forthcoming and giving you the information you really need to know. So I hope you enjoyed this segment and learned something. If you're considering using Dr. Shahine, make sure you continue doing your homework, read more, do your full diligence before you make that decision. In my opinion, you can do a lot better. Thanks for watching my YouTube video. If you like what you saw, please subscribe. You'll always get updates on when we're posting new videos that I think you might enjoy. And you can check out regular things that we post in Instagram and Snapchat as well. Follow me on Instagram at Plastic Surgery Truths, and that profile has all kinds of great Q&A videos that we put up. People send me questions, I answer them. We've got other features you'll find, and of course the ongoing Exposed segment. You'll also be able to follow me on Instagram at Dr. Rubinstein. That's at Dr. Rubinstein, which is my personal page for my practice. And there, you'll see all the kinds of stuff we do around the office, a little bit of my private life, and you'll get to see live surgery because we post our surgery every day. As long as patients give me permission, we're going to share it with you. So you guys can check that out every day and hopefully learn something if you're following me. You can also check me out in Snapchat at Dr. Rubinstein. I love answering your questions. If you guys have questions, send them to me. Hit me on Instagram, hit me on Snapchat, send me a message on YouTube, email me. I'm always happy to get your questions and make videos to answer you so that we can help educate everybody and keep everybody safe. Thanks for watching. Make sure you subscribe. You guys will see me on the next Exposed segment here on YouTube.